it has upon the minority population.
Okay.
Let's talk about that.
We have had sickle cell disease is a disease that's mainly found that blood cells are like sickles, and they're not able to get enough oxygen. And we found that to be a sickle cell trait or a sickle cell disease in mainly the black population and also the Asians. And Meharry has done a lot of research in that. And we have a center, and often they go out in the community, and they're able to go to find out if that is something that's going on with the black population, the black people. And that has been something that we need to know, because you do need to know so you won't marry into families with someone else who has the same trait or the disease. So it's a safeguard. There are many, many symptoms associated with sickle cell disease, and with cramps and leg aches and pains and all. And that's something that has been a good program, an excellent program, and it's known all over the country. And Meharry has that program.
Any person who might feel that they might have the symptoms. Now, how can persons, certainly you've mentioned some of the symptoms of this disease, but how can a person identify either himself or somebody else who might need to take advantage of Meharry's center, even for the purpose of research? There might be some persons who might want to understand more about the research that's going on.
I think it would be good if they're interested in sickle cell, contact the center and let them talk with them about what's available there. Any services that you're interested in you can call. You call our information 327-6111, and they can direct you to what you need. If it's a new person in town who needs medical care and they need to find out if there's a problem, they can certainly call us. We're available. We're there. We're there 24 hours, 7 days a week to provide the services. We have a lot of the centers have transportation to transport people back and forth if they need that. So there are many, many services that I feel, just in talking the time that we have to talk, that we haven't had time to tell you about everything that's there.
Well, we've got about 5 more minutes to talk about some of the areas, but one thing that is of interest to me, you mentioned the fact that Asians are also impacted by the sickle cell disease, and I don't think that many of our audience is aware of that element of the population being susceptible to sickle cell. Now,
that
give us some information in reference to that.
I think in the research they found that oftentimes they found the same type trait in some Asians, and they have found this to be true, and you don't hear it very often, but that's true.
And of course, you would encourage that element of the ethnic population to also come by and to do those things that are necessary to make sure that they're free from that disease.
Yes, and one other thing I'd like to inform the audience is that we have health fairs, and our nurses go out and provide blood pressure screening, testing for sugar, and we often do that, and we feel that's a community service we'd like to provide for the community, to screen and to refer them to their physician if they need it.
Well, we do know that there was a dental fair that was held not long ago. Now, what about some of the health fairs that the nursing population will take part in, some of the future fairs, perhaps, that you might be able to inform our audience of and they might be able to take advantage of?
Okay. Right now, we have a calendar that's usually in our public relations office, and they can tell you if you call to find out if they need services in their own community, in their own church, and would like to have that around the time they're having harvest festivals. We'd like to do that. We were able to provide blood pressure screening. We were able to also provide glucose testing for the homeless recently. And we certainly found that not only in that population, but there were many problems that people had, and they were very grateful for us to do that. And we feel we need to be out there in the community where the action is.
Now, where are some of these fairs located, and what are some of the ideas that you try to use in terms of trying to encourage more people to become involved in these fairs?
We had a health fair at the Preston Taylor home this summer, and we were able to screen people there, and they could come by just to be screened. We did blood pressure, the glucose screening. We also did counseling on pregnancy, prenatal counseling, and also nutritional counseling.
Now, this is a public housing area, one of the largest public housing areas.
And they asked us if we could come, and we certainly graciously did that.
Well, do you think you had any impact upon upon that population at the time for what you were trying to achieve?
Yes, I feel we did, and the people called us back many times and thanked us for some of the findings. That a lot of times you don't realize that you do have problems, and that's why we were able to do that.
Very good. And so what about some of the other public housing
Okay.
areas or some of the other areas that we've got about 2 minutes, as I
Okay.
said.
Well, if anybody's interested in us doing that in their area, not only public housing but churches and in the community, we'd be glad to do that. And they just need to contact us at the local Meharry number and call us for that. Meharry also has a hypertensive program that has been there since 1958, 59, and has expanded now. That is in the hospital and the research that's going on there.
Very good. And Ms. Booth, let me thank you for coming by and giving us that information today. What we tried to do today is to talk about nursing care at Meharry, because I think the perception has gone out throughout the community that perhaps after the consolidation, I think you prefer to call it a consolidation
of
services rather than
yes.
a merger. But however you call it, whether it's a consolidation of services or the merger after this, I think the perception has generally been that perhaps the level of services and the level of care will not be comparable to the level of care at the various hospitals today. And I think that you've indicated that Meharry has a variety of programs that are available, and that the nurses are very, very intimately involved in this as a program. And I think that that kind of information is what our audience needs to know. And I want to thank you for coming by and for giving us that very, very important information. And we also want to encourage you in terms of the kind of recruitment that has to be done in your nursing effort. And let me encourage you to tune in again next week for another informative edition of Comments. Thank you and good morning.